All right, so what do we do with extraction? So what's an extraction? Basically, an extraction is when we have to remove a tooth. A tooth has become broken down or infected or something like that, or gum disease has caused it to be where it becomes dangerous for your body to have that tooth in there. Kind of like a big giant infected splinter, and your body does not want it in there, and it can become a source of dangerous infection for you. And so you want to get it removed. And so when we remove a tooth or extract a tooth, it'll tend to come out one of two ways. One is the easy way, we call it simple. Essentially, we get it very loose to where we can grasp onto it and simply remove it. Now sometimes a tooth is really fragile or really broken down, and that's more complicated. So it's what we call a surgical extraction, where you might have to do some techniques to get the broken pieces out of there easier. And so it takes more time, more complicated, and that would be a surgical extraction. And then after a tooth is removed, say you want to replace it. So there's 4 ways to do with a missing tooth. One is essentially do nothing. And sometimes it's a very back tooth and you may not miss it. Or sometimes it needs to heal anyway. So the first option is nothing. But if you do nothing for too long, certain teeth might shift and move and cause problems with the other teeth. So then you have 3 other options to replace. One is called a dental implant. Basically a bio-friendly screw put into space where you're missing a tooth and left to heal for a time. And then eventually a special crown attached to it to replace that tooth. And those are pretty awesome. And then you have a bridge. And what is a bridge? Kind of like a bridge over water. So you have a tooth on either side of the missing tooth here, and we want to replace the one in between. And so what we can do is take these 2 teeth and cut them down for a crown. A crown is like a hard hat that will fit upon it. So we put a crown on each one. And then we put a fake welded tooth in between that is permanently fused to the teeth. And those are permanently cemented down. And so that's what a bridge is, like a bridge over water. And then the other one is a removable device. Often we call it a flipper. So it's something that it looks like a plastic retainer basically with a tooth on it. So say you're missing a front tooth, we can make this, it sets up inside, people don't see it really, and we put the replacement tooth on there. You do have to take it out, it is removable, and so that leads to some challenges for a lot of patients. And that's basically extractions in a nutshell.